Welcome to our podcast, Katia and Sira. Nice to meet you.
Likewise.
Hi everyone, I'm Katia and I'm a pediatrician, and my partner Sira is a psychologist.
Today we are going to speak about asthma and how it affects children. To start, we are going to define asthma, its symptoms, and its causes.
Asthma is a condition in which bronchioles become inflamed and tend to accumulate mucus. This leads to many respiratory problems and also in mental well-being, which we will talk about later.
Symptoms include coughing, shortness of breath, wheezing, a feeling of tightness in the chest, trouble sleeping caused by shortness of breath, coughing, or wheezing when breathing.
Now that we know what asthma is and its symptoms, let's move on the causes. Katia, what factors can trigger asthma?
For the causes, it's not very clear why some people get asthma and others don't. However, it's likely due to a combination of environmental and genetic factors. Some triggers are airborne allergens such as pollen, dust mites, mold spores, animal dander, or cockroach waste particles, respiratory infections such as common cold, physical activity, cold air pollutants and irritants such as smoke, certain medications, among many.
True. Moreover, controlling these factors can help us reduce asthma attacks. Now, let's focus on another important point, treatment. There are various medications with an anti-inflammatory effects on the bronchial mucosa, but the most potent and effective are inhaled corticosteroids. For immediate treatment, bronchodilators are used, which are usually administered via inhalation. There are two main types based on the duration of their action: long-acting bronchodilators, which are taken in the morning and at night every day, regardless of symptoms, and short-acting bronchodilators, which are typical reserved for use when needed, such as in case of shortness of breath, coughing. In patients with a confirmed allergic component, treatment with antihistamines can also be beneficial.
As for the dosage, the dose and frequency is the same for everyone.
No, this depends on the medication and the severity of the asthma and should be prescribed by the pediatrician. An example would be Ventolin or salbutamol, which for children under 12 years old is usually one dosage before exercise. The doctor may increase it to up to 2 doses before exercise.
Yes, your doctor may tell you to inhale more applications as emergency treatment if your whistling or breathing gets worse. It is important that you follow your doctor's instructions regarding the number and frequency of applications.
That's right. It's also important to know how to use the inhaler correctly to ensure it is effective.
And what happens if a child cannot use it well?
In this case, a spacer can be helpful, especially for your children, as it makes it easier for the medication to reach the lungs without the need to coordinate inhalation with the administration of the medicine. Now let's talk about the physiological impact of asthma on children. Sira, in what ways can it affect?
In children with persistent asthma, a higher percentage of psychological problems such as anxiety, depression, and other emotional problems have been found. These problems increase with the severity of the asthma, being more frequent in moderate severe persistent asthma than in mild persistent asthma. Asthma can cause stress in children due to the feeling of lack of control over their own breathing. They may develop a fear of asthma flare-ups, which sometimes leads to avoidance of certain physical or social activities. This, in turn, can affect your self-esteem and interpersonal relationships.
It's important to recognize that asthma not only affects physical health, but also emotional well-being. Good disease management and psychological support can make a big difference in the quality of life of asthmatic children.
Exactly. Education and accompaniment are key for children and their families to face the disease in the best possible way.
Thank you very much, Katia and Sira, for joining us today and sharing your knowledge and experience with us.
Thank you.
It's been a pleasure.